How are we all doing? Nick, NK Sports Podiatry. So here's a quick video on taping for your plantar heel pain. We have a kind volunteer, one of our fellow podiatrists at NK Sports Podiatry, Steve.
Hello, hi.
Now this tape is rigid zinc oxide tape. Personally, in my hands, the flexible kinesiology tape doesn't work very well for taping this, because the mechanism of action I want to try and apply, I want to try and get the tape to try and support and take some of the load, and I just personally feel a flexible tape's not going to do the job. So let's get started. So first off, we want to strip roughly going from the base of the big toe to the base of the little toe. And we'll rip this in half, hopefully it doesn't crease all up together. It's playing ball. So let's go. Base of big toe, round the heel to the base of the little toe. And we'll worry about rubbing that all in later on. And then same again, nice and tight. Good. Now what we want to try and do is now we're going to start placing some tape across the foot. So what we want to do now is quickly just rub this tape in so we can start to get the tape to take the load of the fascia. When you do this, you notice the toe will start to come down. Now actually what we want to try and do here is start just behind the big toe joint, and we really want to be trying to actually pronate the foot, pull the foot into the ground. A lot of people think actually to help offload the plantar fascia we always need to supinate or roll out the foot. Well, a nice study by a orthotist over in the States, he's a Gogler, actually showed us that if we pronate, roll the front of the foot in, then actually we can offload the plantar fascia much better. So this is what we try and do with this method of taping. And then we overlap again, nice and tight pulling, trying to pronate that foot. And now, after we've done the first two strips, we now go the opposite way, starting from the lateral outside of the foot and then pulling nice and tight. And we're now putting some compression on the heel and the fat pad, because it's quite often when we got a plantar fascia issue, we got a bit of fat pad irritation, and the fat pad actually likes to be nice and compressed. And what you tend to find, this tape when you stand up, the foot will feel nice and supported, but quite often it can give you immediate pain relief, and I sort of call this our convincer or get out of jail free card. It's something that we don't want to use for a long term. I tend to get people to try and keep their foot taped for around 6 weeks, whilst we're doing other things like orthoses, stretching, strengthening work. Now once we've gone round the foot, we now just start putting some bits in just to hold the tape in place to make sure it doesn't fall off. Obviously, if you've got any allergies to zinc oxide, then we don't use it. Also, if you've got any sort of long-term conditions that can affect the foot, so something like diabetes for example, where we can sometimes get skin issues, we don't want to risk aggravating that or causing any problems, so we advise don't use it. And then finally, if you're taking long-term steroids, just because you can get thinning of the skin, I don't want you to get any lesions or anything. Obviously, if you start to have a reaction when using it, take it off straight away. Then another bit just to hold those bits in place. And then one last bit over the top of the foot. This bit's nice and light, just to stop your socks catching everything. Now, I try and tell my patients to keep this on for a couple of days, then let the foot breathe overnight, give it a good clean, because if you leave this on for 3-4 days, quite often the skin can get quite macerated underneath. So there we go, there is my version of taping with what we call Lodi fashion with zinc oxide for plantar heel pain. Hopefully that was useful. We'll see you all soon.